Okay, and we're adding Jill Harris. There's Jill. Excellent. Excellent. Jill. Excellent. Okay. So we're all here today to talk about kidney stones. You know, I'm David Goldfarb. I'm a nephrologist at NYU in New York City. I'm a kidney stone patient myself and a kidney stone preventer as well. Jill Harris, of course, many of you know, is one of the world's experts on the relationship of diet to kidney stones and kidney stone prevention. And we're here to answer your questions and talk about a variety.
Now, people may be shy, David. We have to deal with that. That's okay.
Jill, let me ask you a question. When you think about fruits and vegetables as a part of the kidney stone diet, which parts of that worry you and which parts of are things that you approve of? Jill, I can't hear you. Well, so William, Jill, I'm going to interrupt for a second. I don't know, we can't hear you. But William asks, he was using sodium citrate and citric oral 500 milliliters, but it was hard on the bowels. Okay. And William says our product that we're talking about, Moonstone, was a little bit easier. Can you suggest anything? Well, you know, one of the things about potassium citrate, sodium citrate, some people, I don't know if it's the sodium, the citrate, what exactly people have a bowel problem with. One of the things about Moonstone was that we made it a little magnesium, a little sodium, a little potassium, and that's a way of kind of perhaps minimizing some of the bowel effects. So that's one of the things we like to do with Moonstone, just like I like to do with potassium bicarbonate or sodium citrate. Dilute it in lots of water, drink it over a longer period of time. Don't take it as a shot. Make sure you have food in your stomach when you take any of these products. And that's a way of minimizing the effects of any of these alkali preparations, Moonstone, sodium citrate, potassium citrate, or the like. Thank you. Jill, can we hear you now? Linda, is either Moonstone powder or the capsule better than the other? I think they're both the same. I think they're equivalent. One packet of powder is 30 milliequivalents. 2 capsules is 30 milliequivalents, and you can dissolve them in as much water as you like. There's Susan Polly. Susan, how are you? Ask Jill to okay. Any other questions? You know, Moonstone has come in different flavors, and my favorite is the lemon lime. But some people find the lemon lime a little strong, and my recommendation generally is to dilute it, just add more water. Do either the powder or the capsules need to be taken at the same time of day? Generally, I basically would say if you want to take it once a day, a good time to take it would be with the biggest meal of the day. So if you're taking dinner, that would be a good time to take it. But it doesn't really matter otherwise. And also, it's a good idea to take it when there's food in your stomach, because that could minimize any of the effects of the citrate or the other things that are in there. You can put the powder in your water bottle when you're cycling, Steve Daniel, but it won't have any effect on oxalate except to keep it soluble. And is it relationship any to bad food? Definitely. I definitely tell people, you know, to some extent, citrate, potassium citrate, Moonstone, whatever, is to some extent an antidote for animal protein, which has a lot of protons in it, more acid, and contributes to stone formation. So I like taking Moonstone with your hamburger or your steak, but you want to minimize those animal protein servings is something that Jill could tell us if she got back here, which I really hope. Can it be taken more than once a day? Definitely. You can take it a couple times. There's not too much of anything that's going to be dangerous, so you can certainly do it that way with your meals. Michelle, based on a lemon lime for 5 months. Oh, she's been on it and so sent in a urine 24-hour urine collection. You know, actually, I just did a study where we got 10 people with calcium stones, 3 with uric acid stones, and 3 with cystinuria to look at their urine chemistry, and it had a nice effect on urine chemistry. Jeannie, you're correct. I think you are correct, Jeannie. You said 3 capsules is 30 milliequivalents, and I said 2 capsules. And you're absolutely right. And I apologize. That was a, you know, I'm doing a lot here. I'm doing the Facebook Live. I'm reading text messages from people. I'm reading the questions. I'm hoping Jill gets back. So I apologize that I made that dosing mistake. Do you have any suggestions about what to do if I feel a kidney stone attack coming on? Excellent. Okay. Now I got Jill is getting added. What to do if you have, Jill, say something.
Hello, can you hear me?
Excellent.
Yay.
Jill, I was talking about animal protein without you, and I was insecure about doing that.
What do you want to know? Is the patient asking how much they should have?
People asked if taking citrate preparations with bad food was a good idea. And I suggested, you know, if you know you're going to eat animal protein as an example where you're getting acid and uric acid, that was a good time to take citrate preparation like Moonstone.
Yeah, I think so. I mean, if you're going, listen, and also eating animal protein is not a terrible thing at all. So for the meat eaters out there, you can absolutely have it. It's when we're eating a side of beef every day that we get a problem. So it's always going to be about portion, people. So you go on paleo or you're on keto, even though keto is a high fat diet, most people overeat the meat. Look, when you take away one food group, we naturally as human beings are going to overeat the ones we're allowed to have. So it's not that you cannot have animal protein. It's you just can't eat as much as you want. Those days are over. We're not 12 no more. We got to rein it back in, people.
Great. Jill, Lynn is asking about almonds and calcium oxalate stones.
Almonds. So you can have no almonds, NO to almonds. This is what I say. Why? Because they're so high in oxalate. So I take spinach and almonds away because no one ever said, honey, get the bag of almonds and have 2 of them. It doesn't happen. You want a lot. So when I talk to patients all day long, the problem with why they got calcium oxalate stone in so many cases is they overate the highest oxalate foods along with getting absolutely no calcium in their diet. That is what mainly happens in my practice.
Okay, good. Linda asked about what to do if she feels a kidney stone coming on. So I'm going to tell you my prescription for kidney stones, okay? Number 1, relaxation. Number 2, get into a warm bathtub and light a candle. Number 3, drink a relaxing beverage, okay? I can't tell you exactly what I prefer, but it's usually okay. And then I take 2 Aleve twice a day. Aleve is a non-steroidal. It may actually give you a little pain relief, and it may help stones pass by reducing edema in the ureter. So that's my general prescription. If you're trying to avoid going to the emergency room and you know it's a kidney stone and you're hoping it's going to pass, those are my recommendations. Okay. Diane likes cranberry raspberry and wild berry. And Bobby says almond milk. Jill, did I sent you our thing about
yes, and I have an article on it. No to the almond milk. Again, there's other options, so why even? So you have other options.
Right. We had Ross Holmes and John Knight at University of Alabama test the oxalate content, and it turned out that oat milk, non-nut milk alternatives were not very high in oxalate. So we were glad.
You have pea, you have oat, you have flax, all of those, coconut milk, all of those are okay to have. Unless you have cholesterol issues, then coconut milk would not be the best because of saturated fat.
Right. Yeah, good. That's an important point. And then someone says, is the amount of water that you add to a packet important? And now you're talking about Moonstone. So, basically, I do think that usually we recommend half a liter, about 16 ounces, but you can add more and dilute it and drink it over a longer period of time. That's quite okay too. Jill, here's a question for you. Do vegans get more stones because of the oxalate content?
Not necessarily. I mean, let's just say this. I have vegans in my practice, obviously, and it's not because I want to be clear about this. So people who are like, oh, shoot, I was going to be a vegan. You can be a vegan. You just can't eat as many spinach and almonds as you want anymore. And again, with vegans and vegetarians, they typically don't get enough calcium in their diet. And if they are trying to do it, they're trying to get it with spinach. So that's the rub there. So you can absolutely be a vegetarian. You can be a vegan. You just have to spread out the oxalate. There's so much you can still eat. You just have to take spinach off. Eat kale. People say, Jill, it's not the same thing. Get over it. Stones are terrible. Stents, lithotripsies. Who cares about spinach?
Excellent. How do you feel about taking dairy with some oxalate-containing products to minimize oxalate?
Yes. Absolutely. So what I say, because in my experience of 21 long years of doing this, people will say, yo, Mary, go get the milk. I just had 2 milligrams of oxalate. And then before you know it, they're having 2,000 milligrams of calcium every day, and they're not absorbing all that. So I always say, if you're eating a food that's higher in oxalate, say a sweet potato. Oh my God, she's saying I can have a sweet potato? Yes, you just can't eat 2 of them in one sitting. Come on, people. So you have a half of a sweet potato. That's exactly where I would couple it with some non-dairy or dairy calcium product. Okay, so I give, just because people like numbers, I'll say, look, if you're having about 30 milligrams of oxalate in a sitting, that is where you want to pair some calcium. Otherwise, just get your calcium throughout the day. Spread it out throughout the day. I'll have some people that say, you know what, Jill, you're a pain in my tush. I'm just going to get 1,000 milligrams of calcium. I'm going to drink 3 glasses of milk for breakfast so I don't got to worry about it no more. Don't do that because, again, your body's not going to absorb it all at once. So you need to spread your calcium throughout the day. And yes, if you're eating something that's particularly high in oxalate, that is where you want to then pair one of your calcium sources for the day right there with that meal. Does that make sense, Dr. Goldfarb?
I got it. Yeah.
Okay.
And Linda's asking about how do you feel about chocolate and berries?
Okay, I'm going to tell you, Linda, I'm so happy you asked. Couple things. Have berries. You can't have raspberries because, again, they're really high. So, look, this is what I would do. I have family that have stones, so I follow everything I ask people to do. That's why I know it's hard. But as far as berries go, some people are like, Jill, if I don't see a raspberry in my yogurt, I'm just going to get my shovel, dig a hole, and jump in. Okay, Tom, I'm going to give you a raspberry in your yogurt. Have a couple, and then surround it with all the other low oxalate berries like strawberries, blackberries, and blueberries. So you still get a nice little eye full of a quantity, and you see your little raspberry, and it's paired with calcium. But typically, when we're doing raspberries, you'll hear patients say, I love them, I love them. And that tells me they're eating a buttload of them. So have a couple, but if I were you, like I don't eat raspberries. I just take them off the list so I don't even get annoyed. So I have blueberries, strawberry. You can have any other berry. Just stay away from raspberries. If you need to see a couple to make you happy, fine. Chocolate. Jill, I can't ever have chocolate. No one said you can't have chocolate. It's when we have 5 chocolate bars a day. Do people do that? Yes, they do. So again, it's always going to be about portion, not perfection. If you're the kind of person that's like, well, if I have 2 squares of chocolate, I'm going to have a whole bar. You can't have chocolate, just like I can't have Cheez-Its because they're like crack to me. So know who you are. If you can't do it because you're going to go nuts, sorry, that's high oxalate too. But if you're going to overeat chocolate, if you get triggered by chocolate and it's going to send you down the chocolate hole, then you can't have it. If you could have, if you really want it and you are able to limit it with a square or 2, absolutely. Maybe you want to pair some calcium there too in a non-dairy or dairy form. Absolutely fine. My patients eat chocolate in normal portions, little bit, and when they do their follow-up urine collections, oxalate's like a baby doll. Beautiful.
Excellent. Fantastic. There's a question. Now I've scrolled past it. I think Jeannie had uric acid stones, wants to drink more to get her urine pH up. And, you know, the one thing I'll say about uric acid prevention, I always prescribe citrate at nighttime because you only have to alkalinize once a day to prevent stones if you're not trying to dissolve them. So you can have more citrate. She wants to get her pH sticks to green. I admire that aspiration and agree with the plan. Take it all at once. Instead of spreading it out a little bit at a time, get a big bolus of alkali into your urine at once, and you will dissolve uric acid stones. And someone asked, do you have to worry about oxalate if you have cystinuria? And the short answer is no, don't worry about oxalate if you have cystinuria. Let's see. Oh, and then someone else asked, what about taking Aleve if your kidneys are compromised? If your kidneys are compromised, here's what I'm usually saying. If you're going to pass a stone and it's going to take a couple of days, you can take Aleve, a couple of days, because the effect to change kidney function is very short-lived. It's reversible. So don't tell your nephrologist that I said this, but a couple of days is not going to hurt you. You'll be okay with that. And just, you know, don't take it forever. Don't take it every day. And of course, at some point, lots of Tylenol can help with pain relief, but non-steroidals like Aleve can help pass stones because they're anti-inflammatory and reduce edema in the ureter. Okay, let's see, did I miss any questions there? Oh, here, okay.
It's a lot to juggle.
Yeah, we're good. Okay, and the other question that I like to ask about, oh, I know, here's the question that was asked about coffee, and what would you like to say about that? I think we'll probably agree on this topic.
Coffee. I mean, people were like, oh my God, I can never have a cup of coffee again. Of course you can. And as a matter of fact, there's been studies done that show, and just hold on before you go run to Mr. Coffee Maker. Coffee, tea, soda, all kinds. It can actually reduce stones. Why? Is there something magical in those things? No, it's fluids, people. So it's as long as, now, I'm a nurse. I'm never going to tell you to have a soda. It's filled with sugar. You're going to pass your daily limit of added sugar right there. But I'm just saying, if you wanted to have a diet soda, if you wanted to have a coffee, a tea, none of that matters. It will actually decrease your stone risk because you're adding fluids to your day. It is when we overdo 7 cups of coffee a day, or you're going to Starbucks 3 times a day. Those cups of coffees ain't no cups. Okay, I'm talking Edward Hopper, 1952 diner cup of coffee back in the day, not what Starbucks says is a cup. So have a true cup or 2 a day. Fine. What do you think, Dr. Goldfarb?
Totally agree. There's a bunch of studies that show, there's no study that showed that coffee was associated with more kidney stones.
Exactly.
A little bit of oxalate in there, but every study of coffee showed prevention of kidney stones. So and that's true of alcohol as well.
Yeah.
So I'll just tell you my personal, as a stone former, calcium oxalate stone former, 2 coffees in the morning and very often 2 beers at the end of the day. I haven't had a stone in a long time, and it's mostly fluid and a little bit of Moonstone. But it's definitely true that those products, although there's a reputation that they have for dehydrating you, I don't think that's true at all, because you just have another glass of water.
Exactly. Now, I want to just say this, though. This is something because when I say something, people are like, Jill said I could get drunk every night. She said booze don't matter. That's not what Jill said. The bigger thing with booze, so have a drink or 2 a night. We don't have a problem with that unless you have other medical conditions that would be contraindicated with it. But here's the deal as far as somebody who talks about diet all day long. Nobody ever gets a little buzz and say, honey, get me the kale salad. No, we want a burrito. We're going to drink more booze. We're feeling all kinds of crazy. Nobody's ever like, listen, I had some wine, get a glass of water so I could chase it with it, my stones. No one's thinking about that. So when we get buzzed a lot, typically more food choices. So that's the other thing I like to remind people of. And no, Jill didn't say you could get drunk every night. I'm just trying to clarify. All right.
Yeah. Okay. And Scott mixes Moonstone and Club Soda with booze. And we're in favor of it. Love you, Scott. I don't mix it with whiskey, but tequila and vodka, I've tried all of that stuff. And Lynn says, yes, very little oxalate in coffee. I agree. And it prevents kidney stones. What about tamsulosin? Asks Susan. So tamsulosin is Flomax brand, right? And it's interesting. These drugs, so-called alpha blockers, relax the bladder and the ureter. They have effects on the muscles in the urinary tract. And so the thought is that they might help prevent kidney stones. However, the European data have been pretty negative, and European urologists now are not giving those drugs at all. But American urologists think that they're inexpensive, they're safe, and so they're still relatively popular in the United States. I don't think they hurt, and I think if you want to take them, they may be useful, but the data have been inconclusive regarding their use. Okay, then what happens to these questions? They stop scrolling at some point. Jill, what else is, what other beverages have you promoted? Beer's okay.
Yeah, I really do tell, my whole motto, and anyone who knows me knows I'm all about portion, not perfection, because when we start telling patients, we're asking patients to make a lot of dietary changes. And I have found, I love talking about the kidney stone diet, but what I really love is helping people change their habits. That's what we're doing here. And it's super hard to do that. Some of us have had these habits for decades. So my deal is this. You want to make these changes, but you have to leave things in your diet that you enjoy. You can't be looking at your plate every day going, what the hell is this? I don't want it. Or I can never have a beer again. So you have to talk to a patient and say, listen, Fred, what are the things you think you can't have and that you're really missing? Because I'm going to work them in. So mostly when I'm dealing with patients, I'm bringing stuff back. I will say you can have every beverage, except I'd be very careful with high sugar beverages. I don't know why we're drinking really high sugar stuff. That means soda, that means lemonade, that means just all the things that have high sugar. I'm more worried about sugar than most other things because of diabetics and obesity and everything, fatty liver. So for me, I do tell my patients, look, if you want to have a soda a couple times a week, I'm not looking. But overall, I'm not a fan of high sugary drinks. Other than that, enjoy whatever makes you happy within portion.
Excellent. Somebody asked, Deborah asked, what about decaf? No difference between decaf and regular caf. From the coffee point of view, both have been associated with fewer kidney stones. So no, there's no difference. Michelle asks, drinking Moonstone for calcium oxalate stones with a low urine pH, how is that helping? Well, that's a good question. You don't necessarily, part of the thing for Moonstone is, or any citrate preparation, is to increase the amount of citrate in the urine. And that often correlates with the pH of the urine, but it doesn't always. Some people will have more citrate in the urine and the pH doesn't change. Some people have an increase in pH and the citrate doesn't change. We don't really completely understand why that's the case. But the fact that your pH isn't changing does not mean that you're not having an increase in citrate. And it's a really interesting question, and I can't honestly tell you very much about it. Jill, what's a good source online for, this is Jay asking about, where is the diet information online? Of course, I have handouts that I can send to people. I'm sure you do as well.
Yes, well, my website is called Kidney Stone Diet, kidneystonediet.com. I also have a YouTube channel explaining what the kidney stone diet is. But if you go to kidneystonediet.com, you will see I have so much information on exactly what it is.
Right. Someone asks, are there any nuts that are low in oxalate?
Yeah, here's the thing about nuts. People will think they can never have nuts again. Not true. I do take away almonds. When I'm cooking, and again, I follow the low oxalate protocol too, which I give people, we may differ on this, Dr. Goldfarb, but I give my patients 100 milligrams of oxalate a day. Dr. Coe will say you can go up to 200. I keep it around 100 because when I give, people take more typically anyway. So it gives them, for calcium oxalate stone formers, my vegans, my vegetarians. What was the question? I lost my mind for a second. Oh, nuts. Yes.
Well,
so the only nut I take away are almonds because they're so high. But pistachios, sunflower seeds, those are seeds, walnuts, I'll use them in my recipes. So again, as long as we're not eating, what do I hear all day? I ate handfuls of them. Don't eat no handfuls of nuts. You can't do that. You put nuts in some of your recipes. You want a few nuts, fine, take it. It's not terrible. It's what we do, the amount of times per day, per week, and the quantity, along with not getting enough calcium. Once you get your portion sizes down, I truly take away about 5 foods from people, and that's it.
Yeah. Jennifer asks about people with peptic ulcer disease and citrate. You know, this is definitely one of the things I said before about tolerating citrate preparations. More water, always with food in your stomach. Moonstone is an example, or potassium citrate. You can dissolve it in lots of water and drink it over a longer period of time with food in your stomach. But you're absolutely right that that can be a limiting factor. So, you know, that you got to drink a lot of water. Regarding citrate, when it causes problems, okay, Jennifer, I did get to that again. I saw that. Okay. Chris Rains asks, is this being recorded? Yes, Chris, it is. And Marshall Stoller said Brazil nuts are good for cystinuria. You know, I don't know that. I'm going to ask Marshall that later today. But I like that question. Is there a reason why Brazil nuts might lead to alkalinization? Jill, do you know?
I don't. I have no idea, which is fun. I love not knowing. Yeah,
it's good. And then Joe asks if Moonstone helps with onset of CKD. And here I'm going to tell you chronic kidney disease. The question about chronic kidney disease is something interesting. There's an idea that alkalinization could be decreasing progression of chronic kidney disease. That there are a bunch of studies that suggest that that's true. There is no study that completely proves it. Most of us believe that it's worth giving alkali, citrate. You know, if you have chronic kidney disease, an increase in creatinine, a decrease in GFR, there's evidence that alkali is good, and it's possible that alkali like Moonstone would be useful, but that has not been proven. Richard asks if calcium carbonate is a good source of calcium. Do you have an opinion about that, Jill?
Not really. You know, I'm not a supplement person whatsoever. I like people to get it by food because it's just absorbed better that way. A lot of things I read will say that the calcium carbonate is better. You know, I leave that. I send patients back to their doctor to talk about that.
Right. I'll tell you one other thing. I usually give people, if they can't take, I completely agree with Jill. Try to get your calcium from mostly dairy products. That's absolutely the case. If you can't do that, and there are people like lactose intolerance and the like, then it can be difficult. My preference then would be calcium citrate, because you get a little bit of citrate in the urine from calcium citrate pills. Calcium citrate's also more absorbable by older people and people who are taking PPIs, proton pump inhibitors. So I prefer calcium citrate as a calcium supplement if you can't get it from dairy. And will taking antacids like Mylanta nullify the effects of Moonstone or citrate? And the answer is no. It won't have any change. Those drugs do not change urine chemistry.
And then I'm going to interject too, Dr. Goldfarb, and say that if you are, and there's plenty of non-dairy ways to get calcium as well. But if you cannot do it through food, because it's harder to get it through non-dairy, you can get the milks. You can definitely do the non-dairy milks. But if you have to take, because bariatric patients will have to take supplements in pill form, and there are a subset of patients that absolutely have to, make sure you're taking it with food when you're taking that supplement.
Definitely, right. Lynn makes a great point. This whole interesting idea about whether calcium supplements might promote calcium deposits in blood vessels. So Lynn knows that there's a bunch of literature that particularly women are prone to getting increased rates of heart attacks and strokes with calcium supplements. Not all the literature has shown this. Some studies have, some studies have not. And so, you know, that just emphasizes Jill's point. Dairy should be the source of most of the calcium, and calcium supplements might have some adverse effect. I'd say that's controversial. The other thing that's interesting about, because there's a big relationship, of course, between bone disease and kidney. And from that point of view, it's really interesting that postmenopausal women who take calcium and vitamin D supplements don't have much of an effect on bone density. So it's kind of disappointing. The thing that I talk to people about all the time is making sure you get your dairy as a source of calcium and do weight-bearing exercise for bone issues if you are, at risk. Not just women, of course, as well. Lynn discloses that she's a renal dietitian. Excellent. Okay, what do we take? Call about women about calcium and vitamin D. Oh, I see. Should women take calcium and vitamin D? I have to tell you, if you really have a low bone density, my preference is for bisphosphonates, which I think are really dramatic and kind of people worry about a little too much, because calcium and vitamin D, like I said, are kind of disappointing. So get your jumping jacks in.
And let me just say this. I want to say this. Look, I got some old lady muscles for myself at almost 60 years old. And people, and I lift weights 5 days a week. And women especially will say, I don't want to get so big. I'm not so big, okay? So I don't want anyone here thinking, I don't want to lift weights because I'm going to be like Arnold Schwarzenegger. No, you're not. Relax. You're not going to. So you need to lift some weights. I do not want osteoporosis. I already have stage 4 cancer. I do not want bone disease. I try to do whatever I can to limit any medical conditions I have. So ladies, and yes, of course, men lift. But, and it doesn't have to be 500 pounds, lift 3 pounds. What do I care? But lift some weights, people. Do push-ups. There you go. It doesn't even have to be that dramatic. All right, go ahead, Goldfarb.
All right. William, does drinking Moonstone over a longer period of time, does it work the same? That's an interesting question. And honestly, I don't know the answer to that. I think drinking it over a longer period of time is probably good to keep your blood and then your urine alkaline. So I think that's a good idea. We don't have a slow release form of Moonstone at the moment, but it's a kind of an interesting point that you're making, William. So I don't know exactly the answer to that. Okay, and Jill, now I do want to arm wrestle with you.
I know, right?
Yeah.
I love feeling strong. I think it's such a wonderful thing, and especially as a woman. I mean, when, working out to me is all about, it's not about looking cute in a bikini. I'm too old. Nobody wants to see that. I always tell my patients this. It's about feeling strong. It's about feeling like you're in control somewhat of your health. You're doing everything you can to be as healthy as you can. It's not a guarantee, as I'm a great example of that. But when I did get sick, because I have any other medical conditions, I was able to sail through multiple surgeries, radiation, chemotherapy, you name it. I got through it a lot better than somebody who is really overweight with comorbidity. So, because people say, you still got stage 4 cancer. Why do I got to do what you're doing? Look what happened to you. Because it's no guarantee, but it is very helpful when you're struggling and when you're ill for years. You get through it a lot better than if you are battling also with CKD or diabetes or cardiovascular disease, all of that. So it's always worth it.
It's completely true. There was a great article in the New York Times this week about sarcopenia, loss of muscle mass. Really the point was at any age, you can pick up a little tiny bit of weight and you can gain muscle back.
Absolutely.
Very important, right?
Yep.
Scrolled backwards, Richard Rosenbaum asked, what's the basis for the 30 milliequivalent dose? And I'll tell you that that's kind of a traditional number for citrate supplements. Urocit K, potassium bicarbonate comes in around that idea. And my thought is, if you eat a Western diet, which includes animal protein, you are going to have about 1 milliequivalent of acid per kilogram of body weight. So a 70 kilogram person, if that person exists in the United States, that's about, you need 70 milliequivalents of citrate. And so the 30 milliequivalents is 30 milliequivalents times 2 is going to neutralize most of the protons, the acid that you take in the course of a day. And that's kind of the idea. It's a traditional number. It's 2 tablespoons of sodium citrate liquid, 2 tablespoons of potassium citrate liquid, that kind of thing. That's where that comes from. Lynn says, the renal dietitian, love to get her nephrologist onto the Moonstone product because there's a lot of non-adherence with other things,
Yes.
right?
Mm-hmm.
With Eurosit K. I mean, one of the ideas, look, the reason we made Moonstone to start with, my partners, Marshall Stoller and Brian Eisner, we got into this idea because people asked us, what should we drink? And there really wasn't a high citrate drink. And Eurosit K has become ridiculously expensive. And a lot of people have GI intolerance of it. So that's kind of our idea. That's how we started getting into this. Jeannie says she took potassium citrate 20 years ago and had terrible reflux and pain. A doctor gave it to her in October, and she after a uric acid stone, but she never took it after she found Moonstone. So we haven't done a study comparing potassium citrate to Moonstone, but it's basically the citrate is pretty much the same. We're in the process of doing studies on kidney stone patients to show that it will have the same effect. So I'm pretty confident about that, but we're in the midst of writing those papers right now. Okay. Jill, anything new in diet and what you've been telling people recently?
Anything new? What's always new is every time I talk to a new patient, it's new for me. Because again, we're trying to change habits and everybody has all kinds of crazy habits that they do. So, you know, I've had a lot of people in my life say, how the hell are you talking about kidney stones for 21 years? I mean, really. But it's so interesting, and what keeps it new for me is everybody is so different in how they think about that diet. You know, I'll meet people and it's 12 o'clock. They're like, I'll do a diet history on them, and they'll say, I'll say, what do you have for lunch? Well, I have a bologna sandwich on Wonder Bread with mayonnaise. Okay. And first of all, I didn't even know you could still find bologna, but there you go. And I say to them, why? Why the hell are you eating bologna? What is bologna? I don't know. But my mother made it for me when I was 6 in my lunchbox. So, you know, again, we're just nothing but a bunch of habits. And so when you really look at your diet and what you're eating, and most people don't even understand what they're eating. They've just been eating it so long. The other thing is people eat the same 5 to 20 foods over and over and over again. People, there's more to breakfast than friggin' oatmeal. Come on, let's get it together. There's a lot of different foods you can have. So that's another big thing I'm always saying. Look, have a wide variety of food in normal portion sizes, but stop limiting yourself so much. So many people do that, and they just don't want to think about food. This is your machine. I don't know why you wouldn't want to spend a couple minutes a day thinking about how you're going to nourish it. Everybody who's watching this has been sick, and everybody knows how terrible it is to be sick. So let's not think about that so much. Let's think about how we can prevent this disease. Take what you need to from your doctor, but as far as nourishing your body and moving it, get it together. Think about how you're going to nourish your body, how you're going to move it. Don't mean you got to bodybuild every day. Vacuum. If you're moving, it counts. Just get off the couch, shut off the remote, and move a little bit. And think a little bit outside the box as far as food goes. And I know you don't got time to meal prep, but you're going to have to make time for that damn lithotripsy and the recovery. It's going to take weeks. So knock it off, people.
I'm lifting. Yeah.
There you go.
Jill, comment please about the keto diet.
Okay, so people will say, Jill doesn't want us to do keto. Jill never said that. So I will take any diet you're on and I will modify it so we can work that diet in, because if that works for you long term, what diet works for you? The one you can do long term, not the one for 4 weeks so you can go to Cousin Vinny's wedding looking real cute in that Sherbet bridal gown. No, not that. You want a diet that works for you long term. If that's keto for you, I'm going to say you can do keto. You just have to get the meat portions into normal, and also get rid of the spinach. Okay, so a lot of people, and the salt is going to be crazy high because people are going to be eating a lot of cheese. So they take away carbs, but they overeat all the fatty cheeses. They'll overeat meat, and very high salt most of the time, and overeating spinach. So right. We do a few tweaks, you can absolutely do keto.
Yeah. Jill, I'll tell you a story that Dr. Atkins came to NY many years ago to talk about the Atkins diet at Medicine Grand Rounds. And I raised my hand and I said, Dr. Atkins, doesn't this diet promote kidney stones? And he said, kidney stones? No, I never heard of that. 2 weeks later, I met a patient of Dr. Atkins and I said, did you tell Dr. Atkins you have kidney stones? He said, yeah. And Dr. Atkins took out his prescription pad and wrote me for potassium citrate.
Oh, no, he didn't. Hilarious. So obviously Dr. Atkins had heard about that before.
I think that's true, right?
Yeah.
We've actually got a guy, Shivam Joshi, is a nephrologist at NYU in Bellevue. And Shivam is interested in plant-based diets. And he's doing 24-hour urine collections in patients who are vegan and people on the keto diet, because this stuff hasn't really been, nobody's really studied it too well. But I agree with all of your points. Jay asks, Jill, if it's important to avoid salt.
Well, yes, because you can spill out too much calcium in your urine. Also, I'll have patients say, Jill, I drink all day. What the heck's going on? Ain't nothing coming out of me. Well, you're eating 7,000 milligrams of salt every day, so that could be a problem. You know, sugar, same thing. So too much sugar will also, you'll bloat up, and also you'll leach calcium from your bones. So lowering your sodium. And what does that mean? When a healthcare person says lower your sodium, patients don't know what that means. So we ideally, this is how I do it. If you're eating about 7,000 milligrams or 5,000 milligrams of sodium every day, we would really like, the kidney stone people, the American Heart Association, we'd all really like you to get down to about 1,500 milligrams a day. It used to be 2,300. That keeps getting lower and lower. But this is what I say to patients who are used to 5,000. I'll say, look, Tim, let's first start off, let's get you down to 2,300 a day and then see where we go from there. But you can't tell somebody who's eating a super high salt diet to get down to like a baby doll where they should be in a week. That's not going to happen. The number one thing I can tell everybody that's listening is it took you years to get to where you are. It's going to take you a minute to change your lifestyle. People, it doesn't happen overnight. If Dr. Goldfarb says, look, you got to drink 3 liters tomorrow, he's not going to say that, because you can't do that tomorrow. If you've never had a cup of water, you ain't going to have 3 liters tomorrow. And what happens with patients is they're like, I can't do this after 2 days, and they give up. So somebody's got to be practical, whether we're talking about kidney stones or for diet for weight loss, whatever. You've got to tell people, we have got to tell people, it's going to take a minute. Be patient with yourself. Be kind to yourself. You ain't going to be perfect. You're going to have a great 4 days, and then you're going to have a cupcake. That don't mean it's over. It just means you had a cupcake. Pick up your panties, keep on trucking. The next choice is a healthy one, not next Monday. 1 cupcake doesn't equal a whole week of unhealthy eating. You have your whatever it was, you get right back on it with the next meal choice. That's how you do a healthy lifestyle, not perfection.
Beautiful. Okay, now people demand an answer to Steve Daniels' question. Steve wants to know if Moonstone or anything else helps stones that are up in the kidney come out. And you know that I love that question. I once stood up at a kidney stone meeting and said, you know what we don't actually study? No one studies how stones get ripe and fall off. If we could get them to fall off when they're small, that would be fantastic, right? But the answer is, I don't know of any way to get a stone out. People say jumping jacks, standing on their head. We've heard about airplane rides, cobblestones being things that get stones out. Once that stone is up there, for some reason, some people pass tiny stones, 1 or 2 millimeters, and other people keep stones up there in the kidney until they're gigantic. And what the difference is, we don't know. We don't really understand how stones get released from the kidney, and so we don't know what to do about that. When I promote kidney stone prevention, whether it's diet or medications, I say we're trying to prevent the stones that are there from growing. We're trying to prevent new stones, but we can't do anything about the stones that are there. The exception is uric acid and cysteine stones. Those stones, if you can get your pH high enough, you can dissolve uric acid and cysteine stones with enough alkali, enough citrate. Okay, how much water should we drink a day? My number usually is 96 ounces, 3 liters. Then you're going to get 2.5 liters, and that's what Litholink says is a number associated with a big reduction in supersaturation. Yes, and I like to say water, it's safe, it's legal, it's cheap, and it has only one side effect. You have to pee more. Get over it, as Jill would say.
Yes. Yes.
Okay. John Phillips asks, can buy Moonstone. Moonstone's not available outside the United States, and unfortunately, we can't mail it to you, John. And believe me, I was in Melbourne. I gave lectures in Melbourne. I gave lectures in Sydney and Auckland. And I know that there is very little. It's hard to get potassium citrate even in the Southern Hemisphere. So ultimately, we're aware of that and appreciate your question, but can't help you today. Okay. Someone asked about why sodium is important. And Jill, I think said this, but if you eat more salt, you'll put out more calcium in the urine. That's bad for kidney stones. It's bad for bones as well. Yeah. And Scott, that was the answer to your question. Okay, I'm just scrolling through here and see if there are any other questions about that. Okay. I think, did you hear everybody? This is a good time here. Amazon won't ship to Australia? No. Moonstone is on Amazon, and right, I think I'm pretty sure that is true, that right now you cannot get Amazon to ship the variety of products. Honestly, I can't tell you what the regs are, but it's true. Lynn makes the point that most of the sodium is hidden. It's the food that you eat in processed foods or the sodium that you get in processed foods. Jill, we've had that experience where people say, I don't have a lot of salt in my diet. We look at the LithoLink result, and of course, they've got, I always say, do you have small animals that come and lick your feet at nighttime? Yes. Right? Just, that's what one of my conspiracy theories that I subscribe to. Yes, they are trying to kill us.
Yes, here's the thing. People will say all day long to me, Jill, I don't use the salt shaker. I'm like, Jane, it's not just about the salt shaker. I hope you're not. Here's the thing. You have to, and I'm not winning no friends with this. I say to everybody, turn it around, Buster Brown. And if you're in my age group, you know Buster Brown was this little funny person with a funny hat and their dog on a shoe brand. Turn it around, Buster Brown. When you go to the grocery store, yes, I know, I'm asking for a couple minutes of your time, but again, no stents. Think about it. When you go to the grocery store, look at what you want, turn it around. Look at the amount of sugar and sodium in those products. You are going to be amazed. And then when you see that, salad dressings, ketchup, people are like, I love ketchup. It has no calories. You love ketchup because it's salt. If you love ketchup so much, you just put tomatoes on it's salt. You just use tomatoes, but it's all salt, people. That's why you love it. Mustard. Does that mean you can't have mustard and ketchup? Am I taking that away? I ain't taking that away. I'm just saying, when you got your burger, you got to go, blah, blah, blah. Just do a boop. Do a bip. The hell are you thinking?
Ketchup's a vegetable, right?
Yeah, right. So the point is, turn it around, Buster Brown. Look at the sodium. If you're looking at a product that has high sodium, you can reduce the sodium by having less of a portion of that, or go next door, look up, look down, look left, look right. There's reduced sodium in most things nowadays, okay? And we can thank keto. One thing I like about keto is it made consumers really pay attention to added sugar. So you can see added sugar too. Look at it. If you're looking at a salad dressing that says low sugar, it's going to have more salt. If you're looking at a product that says lower salt, it's going to have more sugar. Because at the end of the day, food manufacturers have to answer to Wall Street. And if the product tastes like junk, we ain't going to buy it. Okay? Yeah. Same thing with bread. Go ahead, David.
Yeah, no, I realized that. I looked that up recently about cottage cheese.
Yeah. Oh my God, so salty.
Right, but there is a low salt cottage cheese.
Yes, there is. It's hard to find though. It's called Friendship, and it's hard to find. It's not everywhere, but yes, cottage cheese is a great example of a really high sodium product that you would never think of.
Right, because I used to talk. You include that on my list of dairy products as a way of getting calcium.
Yeah.
No, it's not so desirable.
Yep. Yeah. Friendship, Jeannie. Friendship is the brand. Yep. It's very hard to find.
Yeah, good.
Because again, people aren't buying low sodium cottage cheese. They're like, Jill, it tastes like junk. But once you lower your sodium and really get used to it, I have found in the last 21 years, on the average, it takes 2 weeks if somebody's really being diligent. That's a very short time to really get used to the low salt. Sugar, you're always going to love it, people. Sugar is always, when you have it, you wean off of it. But when you have it, it's like, oh, it's heaven in your mouth. It really is. But salt, you'll be like, oh, this is a little bitter. I don't like it so much. You'll see. Trust me.
Right. How about, what do you believe in boiling your broccoli rabe or spinach?
Oh my God. I think that's such a, oh my God. I think people, what are you going to save? A few milligrams of oxalate? And what are you doing? Boiling all those nutrients out of there? Don't waste your time. We use the Harvard list. Get that list. Please follow it. I have all kinds of instructions on my website, kidneystonediet.com. You can look at the oxalate list. Of course, it's free. I have a million free resources on my website. Learn how to use it. Don't be boiling your food down to nothing. That's the silliest thing I've ever heard of.
Right. Don't boil chocolate as a way of trying to get rid of the water, the oxalate.
Right. Right.
If my wife serves me a dark green leafy vegetable, I say, I know you're trying to kill me. And she says, I'm your wife. I'm not trying to kill you. I'm trying to make you miserable.
Stop, Luke.
Okay. And Lynn, getting used to lower sodium. Yeah, and that's also true. It's hard to get rid of sodium from your diet. I mean, one of the things that I learned a long time ago, I had a friend who actually studied the physiology of salt taste buds. And what he explained was that you can actually study the fact that when you start losing the channels that taste salt, that's how you know you're on a low salt diet. You know, when food starts tasting salty.
That's very true.
Right? That's when you know that you've achieved it. That's pretty cool.
And I promise that you will get used to it. People have done this for so many years. People really, I'm not making it up. People do get very used to getting on a low salt diet. And then when they do have something salty, they do not like it. I promise you. Trust me with this one.
Yeah. Jay asks what about potatoes? Avoid them, fry, bake, doesn't matter.
Okay, so potatoes. This is a food that people, look, we've all grown up on potatoes. Am I going to take those away from you? No. Am I going to tell you you can't have a baked potato as big as my head every single day? Yes, that's what I'm going to do. So have a baked potato. Split it with your partner. That is where you want to pair some a calcium, non-dairy or dairy calcium product, because they're very high in oxalate. But I do not take foods away that bring people joy, because again, I'm looking for long-term compliance. So have it within reason. Again, get your oxalate list at kidneystonediet.com and you can see how much oxalate is in these products, and then get your calcium every day. And when some people say, yeah, you're a little glib about you saying have this, but I'm looking at follow-up urine collections every day. So I see the effects of what my advice works, not just because I'm the queen of the world, but because my patients work so hard, they listen and they're compliant. So when they listen and do you know, the instructions, they carry the instructions out well, I'm looking at the follow-up. So I'm basing all the advice I give on 21 years of experience looking at follow-up, saying, look, he had a baked potato, but he didn't have 5 of them. He got his calcium that day, and his oxalate's less than 30. It's great.
Yeah, good. Jeannie asks if salt encourages uric acid stones. Short answer is no. Salt increases the amount of calcium and calcium kidney stones, but salt has no effect on the amount of uric acid in your urine, which is related to how much precursor purines you eat. And then the other big part of uric acid stones is, as you know, Jeannie, low urine pH, which also tends to go, from the diet point of view, with animal protein for the most part. So salt is not in any way that I know of related to uric acid stones, and I generally don't. But you know, a lot of people with uric acid stones have other reasons to watch their salt. You know, we're all worried about our kidney function and blood pressure, bone density, and the like. But no, sodium is not related to uric acid stones. And what about nuts and uric acid stones? Deborah asks, is that, I don't know, I'm not sure that nuts are an important source of acid.
Again, you know, nuts in general, because of the oxalate issue, I tell people, you know, especially, you know, dietitians are telling patients eat some nuts if they have diabetes, or if they're trying to lose weight, or if people are on keto, whatever, because it's something that fills people up. It's nice and crunchy for them, and they're low carb, obviously. So it's what patients do with that advice. So you know, eat these things within normal portion size. And 5 handfuls is not a normal portion size. A few nuts and something, not a problem. And I don't know of them leading to uric acid stones. Absolutely not.
Right. Yeah, and nuts do have a supposed cardiovascular benefit too.
Yeah.
Right. So yeah, a limited number is appropriate. Yep. Yeah, good. Okay. Yeah, Lynn ate a salty rotisserie chicken. Yes. And her kids didn't like it because it was too salty. Yeah, that's absolutely the experience. That's how you know you're on a low salt diet. That's how you know your mother is a renal dietitian. Right. Okay, good. So we have a couple of minutes. Any conclusions?
Well, I'm going to say about the rotisserie chicken, because that's a fast staple for a lot of cooks. You know, you're just going to throw something together. You can shred that chicken, use it for all kinds of things. You can ask the people that are making your rotisserie chicken. When I go in my grocery store, they're like, "Oh, Harry, get the low salt one. Here she comes. Here she comes." So you can ask them to make. Let me tell you this story. Even if you don't want to hear it, people, just listen for a second. So I would go to my grocery. I'd be like, "Look, I can't have this rotisserie chicken. I'm going to come a couple times a week and get one. Make me one low salt." Of course, I do it adorably charming, and they do it for me. Next thing I know, I go in a couple weeks later. They're like, "You're a pain in our tush." And I'm like, "Why?" "Because now everybody wants the lower salt ones." I'm like, "There you go, people." So you'd be surprised, just because it's not on the shelf, ask for it. Guess what else is behind the counter in a lot of delis? The low sodium turkey. Get it. Ask for it. If you don't see it out, ask for it. And also ask if they can make you a batch. You'd be surprised. If you do it in an adorable way, you'd be surprised what could be done for you.
Jill, there are many of my patients have heard this story. I have a guy who had a lot of oxalate in his urine. And I said to him, "What's your diet like?" He said, "Well, I eat a jar of peanut butter every day." I said, "Stop eating the peanut butter." He looked at me with a deadpan face, and he said, "What would I eat?" And
I mean, come on, right? Oh my God.
I hope he's not here today. Okay, I think we're done. That was amazing. Let's
so much fun.
Jill, let's do this every week, okay?
Love it. So much fun. Thanks. What great questions we got. My God. Right? Very smart people. Yes, love it.
Are well informed because they're kidney stone patients, right? So
that's exactly right.
They want to take care of this, right? And this is going to be recorded. It has been recorded, and it will be available on the Moonstone website. Thank you all for participating. It was great, really cool. You all have a great day and stay hydrated.
Drink, people. Drink some water. Have a great day. Thank you, Dr. Goldfarb. Appreciate it
So much.